COVID-19 or 2019 novel corona outbreak emerged in the city of Wuhan in China in late 2019. And it has become a global health problem infecting thousands of people in almost all the countries around the world. Virus initially causes problems in the upper respiratory tract, and then it can rapidly progress into acute pneumonia and sepsis, which are the most common complications of the infection. The major transmission method of the virus is by contaminated droplets of an infected person. Transmission can be either direct or indirect. In the direct method, when an infected person coughs or sneezes out, contaminated droplets can enter directly into the respiratory tract of a healthy person nearby and cause disease. In the indirect method, the infected person sheds the virus out and it gets deposited on inanimate surfaces such as doorknobs, chairs, etc., collectively known as fomites. When a non-infected person touches one of these fomites and then touches his or her face, the virus can get into the respiratory system. This is why people are always advised to avoid close contact and perform hand hygiene always. It takes 2 to 14 days for the initial symptom onset within an individual. The most common symptoms are high-grade fever, shortness of breath and severe cough. Once the virus is inside the lungs, it invades type 2 alveolar cells and multiply within, while destroying the cell. This triggers an inflammatory reaction at the site. In an inflammation, there are many chemical mediators secreted by leukocytes and other cells. These chemical mediators are responsible for the high-grade fever. Due to the inflammatory response, there is accumulation of fluid and cellular debris inside the lungs. This increases the work of breathing, which leads to shortness of breath. Apart from these symptoms, some patients may present with diarrhea, nausea and vomiting, low blood pressure and increased heart rate.